Hi everyone, this is Bharti Goyal. I'm a childbirth educator and a prenatal yoga specialist, and today we are going to talk about the epidural. What is it? What are the pros and cons of getting one? How is it administered? And when you can get it during your labor. An epidural is basically a regional anesthetic that helps in blocking the pain from hip down while keeping the upper body active during labor. To administer an epidural, your anesthesiologist will ask you to curl or lean forward to increase the space between your spine. Then he's going to numb the area in your lower spine and insert a needle there. Then a catheter or a thin tube is run through the needle and then the needle is removed. The epidural pain medication is then administered through the catheter. This catheter actually stays in place taped to your back till the end of delivery so that additional pain medication can be topped up if required. An important point to remember here is there will be a 20 to 30-minute gap from the time you decide to take an epidural till the time the pain medication actually kicks in. This is because your doctor will take about 10 to 15 minutes to come and put the catheter in place, and then another 10 to 15 minutes are taken for the medication to kick in. Now, a very common question that I get is what is the best time to take an epidural, or is there a window during which only you can take an epidural? So nowadays there is no hard and fast rule, and it totally depends on your doctor, and they can actually give you an epidural at any time during labor. However, most doctors prefer to wait till you're at least 4 to 5 centimeters dilated so that getting an epidural doesn't slow down labor too early. Also, if you're very close to delivery or if your baby is just crowning, it might not really make sense for you to get an epidural, and your doctor may just ask you to push through the last stretch. So now let's get into the pros or the benefits of getting an epidural. The first and the most obvious one is the pain relief. Epidural has shown to be quite an effective pain relief option and provides a good pain relief for 90 to 95% of the moms, which is great. It is also considered completely safe both for you and the baby. Another very important benefit is it allows you to have a good chance for a vaginal delivery while allowing you to stay alert for the birth of your baby, which is a major plus point. Another important point is an epidural will give you some time to get some sleep and rest in your labor, especially if you had a long labor. This is very important since a lot of moms just get very tired if they are having a 24-hour long labor and they just don't have the energy to push during the second stage of labor. So another important point to keep in mind. And finally, in case you need to go for an emergency C-section for an unforeseen condition like the baby going into distress or you developing a fever or an infection, the same epidural can be used for the C-section, which is good because no additional time is wasted in administering another pain medication or anesthetic. So those were the benefits of getting an epidural. Now let's get into the cons or the risks of getting the epidural. The first one is restricted mobility. Generally, once you get an epidural, there'll be a lot of things coming out of you. There'll be the catheter in your back. They'll need BP monitoring, so there'll be a cuff on your arms. There might be an IV fluid to maintain your BP. The doctors will also need to monitor your baby's heart rate, so there'll be straps attached to your abdomen, and there may be an additional catheter since you will lose control of your bladder, so there'll be a catheter for your urine as well. So with so many things coming out of you, it'll be very difficult for you to get out of bed once you get an epidural. As I talk about in my labor and birth prep videos, using gravity and pelvis mobility is generally very effective in helping the labor to move along. So generally, most of those options are not available once you get an epidural. An epidural may cause the mom's blood pressure to drop, which can compromise the supply of oxygen to the baby and cause the baby's heart rate to decelerate. To counter this, generally there'll be continuous monitoring of your BP as well as administration of IV fluids in order to maintain your BP. An epidural may also cause the labor to slow down. This is because once an epidural is administered, the strength of your contractions decrease. In order to counter this, your medical team may require to augment the contractions by giving you artificial oxytocin or pitocin to increase the strength of contractions. Generally, when that happens, you'll feel more pain and then require more epidural for pain relief, and generally it becomes like a cycle where you need to keep adding more epidural and more pitocin to keep the labor to progress. An epidural may also slightly increase the chances of the mom developing a fever. Now, the exact reason for this is unknown. However, if the mom develops a fever, then it is important for the medical team to give you some antibiotics, since they don't know if the fever is due to an epidural or due to some other infection that you have developed during the labor process. So an antibiotic is administered anyway, just to keep that risk at bay. Another con of getting an epidural is directed pushing. Now, once you have an epidural, you can't really feel the strength of the contractions. You might feel a bit of pressure, but not really know when is the best time to push. And for this, your doctor or your nurse is going to tell you when and how long to push. This might not really be effective, and you might not really be able to work with your contractions effectively, which might cause a bit of swelling in your perineum and also increase chances of tearing, as the tissues don't really get the right time to stretch around the baby's head. And finally, an epidural also increases chances of an assisted delivery via a vacuum pump or a forceps and an episiotomy. The reason for this is same as directed pushing. Since you're not able to push effectively, it might take a long time for the baby to come down and out, which may require your doctor to use a forceps or a vacuum pump to get the baby out faster. So this was everything that you need to know to take an informed decision whether epidural is right for you or not. I can't say whether epidural is good or bad. It totally depends on your condition and the medical situation you are in. The important thing is that you are in a position to make an informed decision, knowing all the pros and cons and understanding the risk before you take the decision whether epidural is right for you. So I hope you found this useful. Do let me know in the comments if you have any additional questions about epidural. I'll see you with a new video soon. Till then, take care and bye-bye.